Welcome, everyone. We are delighted to be presenting you with our final knowledge exchange for the spring, maximizing OUD recovery potential through integration and whole person care. We have been really looking forward to this presentation today, and we hope you get a lot of takeaways from it. I'd also like to thank the folks at CCSME for being here and helping us to provide those of you who are wanting CEUs, CEs. There will be information in the chat coming soon. So my job is to introduce Pat McKenzie and to hand it over to you.
Great. Well, thank you so much, Shelley. I am Pat McKenzie. I'm super pleased to be here with you all today. Currently, I'm speaking from my team experience at the Opioid Health Home and the colleagues I work with up there, providing hopefully a very much a whole person approach to care and maximizing the journey of individuals who are seeking recovery from opioid use disorder, but also sometimes many other chronic illnesses and struggles that they have. And so today, I'm going to pass it to a couple people to introduce themselves very briefly. Kirby, you want to introduce yourself first?
There we go. Kirby Pankum, a recovery coach in a person recovery.
Thank you, Kirby. Liz?
Liz Saucier, recovery coach.
And Liz and Kirby will be sharing wisdom and experience today in a conversation. A little interview I'll do, so they'll be with us today. And I just want to note that Audie Horn and Carrie Ann Watson are here in the chat room, and they will answer any questions they can. They are also members of our team at the Opioid Health Home. Audie is a prescriber, and Carrie Ann is the lead clinician, a clinical lead of the program. So that is, I think I got the introductions done. Let me see. So learning objectives. Let's talk a little bit first about the learning objectives, just what we hope. Well, this is what we hope, and we hope these work for you in the audience. We're hoping participants will witness an experience of a recovery, Kirby, and a recovery coach, Liz, in their shared journey within a whole person approach to treatment and recovery. We also hope that you will, as participants, increase your awareness of the many dimensions of wellness that are critical to the whole person approach in supporting treatment and recovery. It's certainly not just the diagnoses that they come for treatment. There's many other aspects when you actually start to embrace whole person. That's very important in getting the outcomes. And also, we really hope the participants will increase their understanding of the potential strengths and challenges in providing a whole person approach to treatment and ongoing recovery. And I really invite you in your own discipline, in your own work, what you're studying or what you're providing for service, to think of those potential strengths and challenges in your practice. And I think we can move on to the next slide. So what is whole person care? And I think I mentioned when Shelley, we were kind of looking at the polls, I said, you know, it can be easy to talk the talk of integrated care, and particularly to talk the talk of whole person care, but walking the walk sometimes is challenging. But I think you'll see from Kirby and Liz's story, their own journey in partnership in recovery, is that it is where you get incredible opportunities and possibilities to actualize real recovery. So whole person care is used to kind of describe a type of care that is patient-centered and takes into consideration the optimal physical, behavioral, emotional, and social wellness unique to that person. It also is really critical that it respects the person's treatment choices, and that recovery includes multiple pathways. There are many pathways in whole person care, not one single sort of manualized approach to it. It's really got to come from that person's place of where they want to go and what they want to do. Whole person care model requires intense collaboration. If you're picking up on some of the words you did in your word cloud, they're here. I was very excited to see those. Requires collaboration across different healthcare providers and specialties so as to ensure optimal health outcomes. It supports attainment of health and treatment outcomes through addressing and strengthening the basic needs, social and cultural needs, and those aspects of the person's life beyond the treatment diagnoses. And it aligns excellently with recovery and wellness orientation and substance use disorder treatment and the new models of integrative models of care out there. I would say, if you have any questions or anything, put those in the chat. I'm sure Carrie Ann and, Audie will be firing off some responses to you. I did want to share one model. There are many models. If you've gone online and you've looked at it, there's a lot of people who have done beautiful infograms and things on what whole person care looks like, what wellness looks like. In a lot of the work we're doing in substance use disorder treatment and recovery, we're using the SAMHSA 8 dimensions of wellness to inform how we approach this. So in our treatment, and you can see, I won't belabor this, and you can go online and check it out. And there's some great articles in SAMHSA about maximizing the 8 dimensions of wellness. But when someone comes into a care, looking at them beyond a diagnosis, beyond what the, in the moment, the immediate is important for us to look at these different dimensions. And you can see they cover a lot in life, well, a life that we all live, emotional, financial, social, our spiritual aspect of our life, our occupational, educational parts of our life, our physical health, very important in the integrated care world, intellectual and environmental. And I invite you to dig in further into these dimensions because they have really informed our practice. I think I can move on. Yeah, move on to the better part of the conversation. And like I said, any questions or anything, please reach out in the chat and I'm sure people will respond. So we're going to interview Kirby and Liz today. That will be my role, is just to ask some questions, and they really have the experience, wisdom, and I hope some sharing of information that will be useful to you in your experience today in learning. I'm going to have to move to my questions because I lost track of my slides here. Okay. So what I'm going to do is a very brief overview here of what we hope is going to happen, which is an interview where I ask some questions. They share their experience, wisdom, hope, whatever that is that they do share, and that I'm asking you all to really think about what resonated with you, what captured your attention, what were you curious about, and what any other questions you might have, because we will be going into some small groups afterwards, and we'll have you be able to have a conversation about this conversation, sort of a witnessing experience. So I guess I'm going to start off with, Kirby and Liz. I'm going to ask you a kind of start off question, which is, can you just briefly kind of introduce yourself and do a kind of a high level summary of when you first when you first, Kirby, for you, when you first came into the recovery partnership, and Liz, you met Kirby, what did you see that that presenting concerns and needs were initially in Kirby's life?
Hi there. I'm a Kirby, and this rock star next to me is Liz, who's been in this journey with me. A few years back, I was just another face in the crowd, struggling with my own set of challenges, from health issues to finding my place in the world. I hit rock bottom and was scared. It wasn't just about fighting against, substance use or taming the beast, that is diabetes. It was about facing down a whole army of challenges that recovery laid on my feet. Now, from the nitty-gritty of income and housing and struggles, from redefining my purpose and carving out like a new community, it felt like I was, rebuilding my life from the ground up on my own. Now, fortunately, I was introduced to Liz, who's been so much to me in this recovery as a recovery coach. She is my compass through it all. Together, we didn't just tackle the symptoms or the immediate hurdles. It was about confronting and overcoming the several barriers that recovery throws at you. Now, I needed proper medical care, transportation, and housing challenges to overcome. and task of rebuilding a life from scratch. It's about, rediscovering life in its full spectrum, embracing the whole person philosophy, from health to home, purpose, and community. Now, the journey from those depths of hardships, where I stand now as a recovery coach, has been nothing short of a life-changing shift for me. This is a testament to the power of holistic healing and the incredible impact that a person who's by your side can have on you.
Yeah, thank you, Kirby. Kirby, I was gonna see if Liz, would you want to introduce yourself?
Hi, I'm Liz. I'm the recovery coach that met Kirby one day. And so it became that we broke it down and tackled those battles, which are many. And a lot of it came from that 8-dimension wellness. So tackling that, it was, he needed a computer in order to catch up and take care of the Social Security and to apply for the housing and to apply for the many needs that he needed to take care of for food stamps and general assistance and so on. And then his medications and then to keep up with all the aftermath of all of that. So it was finding of all those, not only that, and everything that went with it. So the 8 dimensions of wellness is such a huge thing because you follow it, and it speaks volumes of what we do as a recovery coach.
It sounds like this partnership, this relationship, and we saw some of those words come up in the cloud, like teamwork, partnership, connection. It
Still
sounds
going
like
on.
that connection was really important in this journey that you were sharing together, along with all the other treaters that were working with you. Second question kind of was like, you've been working together now for 2 years. So we heard a little bit at the beginning and some of the needs that presented right away, but over the 2 years, can each of you from your own perspective share a little bit more about the journey and the importance of that whole person? How did that whole person perspective, in your perspective, unique to you, really help move forward in this 2-year journey that you've been on in recovery?
Well, on the road to recovery, I found myself, at rock bottom, having lost nearly everything that mattered: my health, home, self-esteem, friends and family, even, my self with purpose. It was like, losing myself, and I never thought I was going to get it back. Now that's the beauty in the whole person care in Liz's guidance. It's a beacon of hope. Now, my battle wasn't just with, substance use, but also a bunch of other health issues, results of years of, neglect. Now, the whole person approach wasn't just a strategy, but it was actually a guiding principle for me. Liz helped me see that healing wasn't just about stopping the substance use. It was also about, rebuilding every aspect of my life, piece by piece. Now, we tackled the essentials first, like ensuring I received medical attention for my substance use and for my diabetes, alongside securing, reliable access to food. Now, but Liz knew that true recovery meant more than just, physical wellness. She recognized the power of, small victories, like repairing my smile, which regained my, self-esteem and dignity. Yet, our journey didn't stop there. Just regaining. Liz propelled me forward and towards, rediscovering and redefining, my life's purpose. She connected me with, community resources, from transportation, stable housing, which is a process we're still continuing to enhance. But Liz also reignited my passion for life, encouraged me to, dive back into like old hobbies and explore, new interests through local groups, volunteer work, and even online stuff. Now, this holistic care for every aspect of my life, body, mind, and soul, that truly set me on the path to recovery. It wasn't just about getting through the day. It was about rebuilding a life to that's worth living.
Yeah, thank you, Kirby. I love your definition, a guiding principle. It wasn't just an approach, it was a guiding principle to the work you were doing. And when you mentioned your smile, are you talking about dental work?
I'm talking about dental work.
Yeah, I hear this a lot with the folks I work with, is that, boy, getting that smile back and being able to let everybody see that you got some good pearls in there, get those all fixed up. That is a real common. Thank you for sharing that. And Liz, for you, same question. What do you think was, for you as a coach in this and as a member of the OHH team, what was the critical aspect of, you think, the importance of whole person work in this journey?
All that was needed, and finding the reliable resources, especially just going through, now you're talking about the last couple of years, why we were in the epidemic, ending through the epidemic, finding resources was the challenge, was a huge challenge. And but you took what you could get at the time, and you still do, and trying to find all these resources and get them when you can, and then the time reflection of it's not like, okay, you call and make an appointment and that's going to happen next week. It didn't work that way. So setting up where you got the time, and you got the ride, and you got the transportation and the appointment, and so it was a challenge, but it made it work.
Thank you, Liz.
Yeah.
Question is, again, looking back over the journey, I guess, what did it really take in the team? I'm thinking about the team because we haven't talked a lot about what our team provides, but there's a whole lot of different aspects. And so I wondered, what did it take, briefly, from each of your perspective, to really build that whole person service plan?
You can take the lead.
Well, it took Kirby to have his counselor, have his med provider, have me, and all of us to work together, so that he had a full whole care at the OHH.
Yeah. And forgive me, I'm thinking what it might have taken, because you also noted there was some dental work, there were all the things that Liz was working around, housing.
Yeah, and still are. I mean, this isn't a done deal. We're still going as of today, so we're still working.
Yeah.
So
in there.
My reflection on this journey, integrating my physical health care with substance use disorder treatment within the whole person care framework, demanded commitment and a complex plan. A crucial step was partnering with healthcare professionals who also valued the holistic approach. And now, as we managed my diabetes along recovery efforts, we were careful to ensure that the progress in one area did not, compromise the other area. Yeah. Now, this delicate balance was challenging but crucial. Yet, the true essential of the approach, was addressing the dimensions of wellness that are often overlooked. Mental and emotional being took center stage, actually, with Liz guiding me through like counseling sessions, self-care practices, helping me confront and heal from past trauma that was fueling my substance use. Now, social wellness came another horizon. You know, rebuilding my social network was tough. You know, Liz Buck played a pivotal role here. She facilitated you know, connections with supportive individuals and groups, creating a new community around me that was built on understanding and shared experiences. Now, in this journey, stepping into the role of a recovery coach myself, it actually has strengthened, you know, my commitment to recovery, adding like a new layer to purpose and perspective to my own healing process. Now, the holistic integration of wellness dimension wasn't just about like recovery. It was about it was like a pathway to like change. No, because we celebrated the small victories and faced challenges with unwavering optimism. Each step forward, marking progress towards a renewed life.
Mm. Wow, thank you, Kirby. So we have just a couple more minutes left, a couple here, but I don't want to miss out on we've been talking about where you started, a lot of the journey, and I love what you said, Liz, is, hey, it's not over yet. There is continued work, but we've made a lot of progress, but this is kind of going to be a relationship that goes on for a while to truly get it. And Kirby, I appreciate you sharing so much about, we know that the struggle between managing the diabetes and the addiction, I love that point you said, sometimes it's hard because these work against each other a little bit, and we have to really stay in touch with each other, whatever it is. If it's dental work and I'm going to have some pain relief, how will that affect my substance use? If I'm just really struggling with the diabetes and the extra work there, how do I make sure I'm still getting to my groups and counseling sessions for my mental health? And how does Suboxone and my diabetes treatment work together? There's so many questions you touch on that are so important for the team to work together and have you at the center of it, helping us know the right direction, it sounds like. But the last question is to pull you back a little bit from it and look across that landscape of your journey of 2 years and ask you a question about what wisdom or expert knowledges you have from where you stand, wisdom and expert knowledges you have for a whole person approach have you gained in this particular journey together? So stepping back and looking at the long haul of the 2 years and maybe forward, what's your wisdom and expert knowledge you would want to share with the teams that are here today with us?
Well, one big lesson I learned from this is the profound impact of whole person care, supported though by a figure like Liz in the role of a recovery coach. The journey through recovery is chaotic, you know, marked by despair and frustrations. I mean, there's a lot of moments there. There was actually countless times when the world like around me just seemed to crumble. Each piece of a bad news was just blow to my already fragile state. But in those moments, Liz was more than just a coach. She was a beacon of hope in the overwhelming darkness. Now, when friends and families, had turned away, when it felt like, the fabric of my world was just tearing apart, at the seams, Liz stood firm. Her unwavering support, her ability to see, through the smoke and chaos, to stand beside me as we walked through the fire together was life changing. Now, is this partnership, this bond that we built, through the challenges of recovery that I want to actually highlight. The journey is agonizing, yes, there is no doubt, but with a recovery coach like Liz and healthcare professionals who believe in whole care, the process is far from feeling abandoned, though. Okay, because this journey with Liz, partnership and the support of healthcare professionals committed to the whole person approach, remains, or at least reminds us that recovery is a joint endeavor. You know, their belief in, you know, treating every aspect of a individual's well-being is not just beneficial to us, you know, but essential. You know, it's laying the foundation for not only healing but also, you know, life-changing growth. Now,
Yeah.
Liz did teach me something though. Even in the darkest tunnels, there's always a light, however faint, guiding you forward. So to
Mhm.
everybody listen here, remember, in the vast of whole person recovery, a coach is that guiding light, that steady hand leading you through not just survival, but actually reimagine in a life full of possibilities.
Oh, thank you, Kirby. Thank you. It's a great testimony of the peer-to-peer work and recovery coaching work that's growing all over our state. And it's not just helping us in SUD treatment, but I know it's a model of lived experience being brought into a coaching relationship that has been super important in lots of the health field out there. But we're a little bit over time. But I did want to ask Liz to be able to we're moving on, Liz, but did you have a last word of wisdom that you would share as a recovery coach, or a last couple words for the audience out there?
Just that what Kirby said is true. It is a whole person thing, and it's whole person wellness, and it's step by step, and everything is different. Everyone is, you know, it's a journey that we start, and we take the most crucial things first, and we work on them, and we try to do the best. And I'm reading the comments too, and about a dietitian, and about and you know, and that is all so
we all have a part
wonderful, and it should be. And unfortunately, it's not always, but we do our best to provide food, and we do our best to provide everything that's needed.
Thank you, Liz. I'm going to move us on to small group, and then maybe there'll be more discussion there, I hope.
Okay.
So we are going to, thank you so much, Liz. Thank you, Kirby. And Kirby and Liz will be facilitating a group. You may get lucky enough to pop into that group. We'll all be in there, but I want to talk a little bit about the breakout prompts. Now, first, we got these 4 prompts, but that doesn't mean you have to complete them all. Please don't feel that way. If you even find one of these in your group that you just want to dive in deeply, that would be fine. These, so we got the 4 prompts. They will be in the chat, I believe, to remind you. So I won't necessarily, but what I'm going to ask you is to think about what resonated for you when you witnessed their story. Liz and Kirby's story, the little bit of that journey they're in and continuing. And how did that impact your thoughts about how it connects to your work you're doing or the education you're receiving? And you might even want to focus a little bit, what was the strengths of the whole person approach in their story? And also maybe what might be challenging in there, not undoable, but could be challenging. And so I think now they're going to send us off to breakout groups. We'll all try to get there. About how much time do we have, Shelley, in the breakout group?
3, 4, 5.
We have 13 to 15 minutes in the breakout group.
And the facilitators will help you get through that 13 or 15 minutes there, okay? Thank you, and I think they're going to send us off now.
I'd love to hear from some of the other groups. I know the group I was in really talked, I guess I would phrase it as there are a lot of things we don't talk about in our health education that are intrinsic and important to whole person care, and that people feel proficient in their specific profession, but in looking at things like nutrition, looking at things like spirituality, looking at oral health, if you don't happen to be in the oral health dental world and vice versa, isn't brought up. And so students are interested in having more of that diversity integrated into their curriculum, which of course thrilled me to no end. But who would like to talk about what happened in their group? Can I call upon Pat or Kirby or Audie, one of you, to light up?
I'm going to pass, I'll speak, but I'll pass it to Audie or Carrie Ann Kirby, one of my team members.
One of the big things, this is Audie, one of the big things that we discussed is the importance of the new physician groups in particular, as well as others, that are coming, that are going to be the future of medicine and the future of treatment, to be willing to do this work. One of the challenges that we have today is that so many people don't seem to want to do that. But I heard a lot of optimism coming from the people in the group that were talking about this. We also talked about the importance of integrating the people from outside the team, people from behavioral health, people from employment, people from nutrition, people from all of the different aspects that cover the 8 dimensions, and how we can pull those in, and the importance of addressing all 8 of those dimensions at the same time so that they stay cohesive.
Thank you, Audie. Another member? Anybody?
Well, we had a lot of questions in the chat, and I just want to mention one from room 2, and then there are a couple of other just general questions that we'd like to put back to the panel, and we'll do it as quickly as possible. But so in room 2, it said that Liz was able to let Kirby lead with identifying what he needed. And so as health professionals, we come in and we have all these ideas about what we can do to help. And it sounds like unless we lead with what do you want, what matters to you, barriers are set up already. You know, it's and Pat, you look like you're resonating with that.
It is so true that the multiple pathways that I spoke of, which we could do a whole hour on multiple pathways too, but that is all about a person driving their own bus. Now, I understand in healthcare, sometimes people get worried that people kind of swerve off the road and maybe they're in the ditch a little bit, but you got to give the wheel back, because I think on my group, people noted how engaged Kirby was. Well, Kirby was engaged because we were gonna figure out where Kirby wanted to go, and then we were gonna have him lead us to it. Whole person care, the driver, the center is that person and what they identify as family and where they want to take their lives. It is a critical piece in the motivation and engagement of people with chronic illness, I believe. Yeah.
It's all
One of
about
the things that
relationship,
I've
right?
learned, I'm sorry, I didn't mean to interrupt. Go ahead.
I was just saying it's all about relationship, but you go ahead, Ani.
I was going to say, one of the things that I've learned, after practicing medicine for almost 30 years, is for a long time, the way we did things in medicine was you came to see me, I told you what to do, you went home, didn't do it, came back 3 months later, and we did this whole song and dance again. What I have learned in the last 4 or 5 years of working in addiction medicine is you come to see me, you tell me what you want to do, and I work with that. Because we're going to be a whole lot more successful if that's what, to me, is patient-centered care. You have to drive the process as the client or the patient. If nothing else works.
Yeah. Perfect. I think in our group, and I want to throw this out to our panelists, but there was a lot of conversation about spirituality. And where does that fit in to your team? How do you manage questions and integrate a person's spirituality if that's important to them as part of treatment? And as a second question, the same thing about nutrition, that where does that fit in?
Well, we also in our team, and Carrie Ann can speak to this too as the lead, in our team, nutrition is critical. We have a nurse care manager that works with us. They're not here. I mean, there's other roles in the team, and the nurse care manager, part of their work is to really look at a person full dimensional and try to figure out what their needs are. In Kirby's case, nutrition, of course, and he brings that up about having good food, was pretty critically important as he had life-threatening diabetes. It was not a simple thing of maybe it's, no, diabetes is simple, but it wasn't just about weight loss and things like that. He has a very serious form of diabetes that nutrition becomes critical. And so we worked with the nutritionists and the dietitians and the specialists very closely. We can't be all things to all people on our team, but we can take and bring partners in. And so the partnership between those individuals serving the, Kirby, that Kirby wanted involved in our treatment became pivotal. The spirituality, I mean, I'd love to have other people from the team speak, but that is a core aspect of everything we do. It's like, and some people mix it up with, we're not promoting a religion, but we are promoting people to have a sense of self beyond their diagnoses, beyond who they are in the moment, and where they want to fit in the world and be in the world. Their own philosophies and understandings of their humanity is really, really important to us. And we do a lot of extra work outside of the treatment, getting people to be involved in groups that support that. Maybe it is a church, maybe it's a 12-step program, maybe it's a group like we have up there in Skowhegan called ROAR. And we really create meaning there of being community members and giving back to our community. It's not just what we take, it's what we give back that is important to us, what we have to offer the world. But I don't know if someone else wants to speak to that in our team, how we integrate spirituality. I know we use art and expressive therapies and all kinds of things to bring it around. I don't know, Carrie Ann, you might want to speak to that.
Yeah, no, that's well said, Pat. And what she was speaking about, the expressive therapies and the horticulture therapy that we do here, we're teaching clients to be mindful, and the concept of mindfulness and getting back in touch with their senses, where they're able to feel grounded and again find meaningfulness back in activities that they probably have set on the back burner for a long time from addiction.
Well, we can't thank you enough, all of you, Liz, Kirby, Pat, Carrie Ann, Audie, all of you. I wish we had more time to talk and to go deeper into these issues, but this is a beginning discussion, and I hope folks are taking away the importance of integrated care. The fact that all of us is better than one of us in helping people who have any kind of chronic health condition, because chronic health conditions are complicated and need more than one profession. All right, I'm done my soapbox. Thank you all for being here. The next event that's coming up is the UNE Northeast Healthcare Professions Leadership Conference. Dora Ann Mills is the keynote for that, and that is Saturday, March 30th, 7 a.m. to 2 p.m. Make sure that you put your attendance in there, and we are always delighted to get your comments and feedback. And our last big event is our interprofessional showcase, which will be coming up April 24th. So if you're interested in submitting a poster, let us know. And we should remind you that the conference that's coming up is in Innovation Hall on the Portland campus. So, wow, I've got so much more to say. I'm sure you have a ton more to say, but thank you all so very much for being here. Thank you all our attendees. We had people from a couple of different states here with us, along with our UNE students and faculty. So thank you so much.